The first three things that I always want to address with patient is inflammation, their nutritional deficiencies, and gut. So if this is our gut, there's a lot of things that can go wrong with our gut. Our gut it's a very complex, it's like a whole ecosystem, right, with different types of species of bacteria. And then there's a few things that we're looking at, right? So obviously we're looking at the bacteria. Bacteria is one of the most important key factors in our gut health. We have the gut brain. So whatever happens in the gut does not stay in the gut. We got the gut barrier, and then we got gut integrity, right? So let's talk about how it's all connected and how is that connected to the condition that you mentioned. Weight gain, anxiety, hypertension, obviously GI disorders, right? Maybe restless leg syndrome, eczema, pediatric eczema. Like, how is that connected to it? So, in our gut we have the beneficial bacteria, right? The beneficial bacteria are really important. So I'm just going to put a smiley face here. And the beneficial bacteria are really important because they help us with metabolism, right? They help us to break down fiber and certain types of carbs. They produce metabolites that are really important, such as short-chain fatty acids. So short-chain fatty acids. Short-chain fatty acids are really, really important because they modulate inflammation. So here you go. It's all starting to get connected, right? So they're immune modulating. That's really important. They also help us with some nutrients. So for example, some nutrients like vitamin K and other nutrients are produced by our gut bacteria. Now they also stimulate, gut bacteria also stimulates our vagus nerve. And by doing so, they essentially create what we refer to as the direct section of the gut-brain axis, right? There's indirect, but there's also direct. So by stimulating it, you get a healthier brain function. How does that happen? If you ever read the research on vagus nerve stimulators, it's fascinating. There's studies that show that when you put in a vagus nerve stimulator, either in the ear area or in the neck area, it actually helps patients who are struggling with anxiety, with depression, PTSD, IBS, right? Because again, of this connection between the gut and the brain, right? And that's through the vagus nerve. Now, and of course, those bacteria help us to also maintain a healthy barrier and then also integrity of the gut. Now, what happens if you, for some reason, you have a stressful life, don't eat enough fiber, maybe your patient is taking some certain medications, they're on antibiotics or other medications, right? And now they're starting to lose that beneficial bacteria. It's starting to reduce, right? Not only that, but opportunist bacteria are starting to grow. So let's say the bad bacteria are starting to grow. Essentially, this is what we refer to as a state of dysbiosis. You don't have enough beneficial bacteria, or you have too much of the imbalanced or sometimes even harmful bacteria. This will typically do several things. One, you'll have less short-chain fatty acids, which we mentioned are really important for immune modulating. So essentially what you have now is a state of inflammation. So that leads to inflammation. You also are now, if this is our barrier, right? If this is our barrier, and let's say this is our bloodstream, and let's say this is our lumen. So food is supposed to stay here, right? Food is supposed to stay here. What happens is, over time, when there's a state of dysbiosis, inflammation, less short-chain fatty acids, less nutrients, right? What will typically happen is you get also they start to break down the barrier and pass through into the bloodstream. Now, gram-negative bacteria will typically have on their external surface, will have something called LPS, which is lipopolysaccharides. Lipopolysaccharides, when our immune system encounters them, it creates a very strong immune reaction. That immune reaction is systemic, right? It's systemic, which means that it also impacts the brain. So lipopolysaccharides by themselves don't cross the blood-brain barrier, but the inflammatory cytokines such as interleukin-6, does cross into the brain. Over time, that can lead to or contribute to neuroinflammatory conditions. It can contribute to anxiety. It can contribute to Alzheimer's, to definitely systemic, so it definitely impact lupus. It can also manifest as eczema. And so the damage, the ongoing inflammation, the damage to the gut, the damage to the metabolism, right, can impact all. That's why I started by saying what happens in the gut does not stay in the gut. It impacts almost every part in our body. Now, which part is going to be impacted more? That depending on the integrity of the gut, the blood-brain barrier. It depends on the integrity of the gut. It depends on also what's the predisposition of your patient. If your patient has genetic predisposition to Alzheimer's, and they got ongoing gut-brain issues, they have dysbiosis that causes systemic inflammation, they're more likely to struggle with neuroinflammatory conditions or neurodegenerative conditions because that's their genetic. If they have genetics of IBD or diabetes in their family, they're more prone to developing those conditions because guess what? That inflammation will go to the pancreas and start damaging the pancreas. That inflammation will go to the cells and start causing and contribute to insulin resistance. There are already reports from 2015 that reports that diabetes, for example, is an inflammatory condition, right? It's not just a lack of insulin condition, it's an inflammatory condition, right? It causes damage to the receptors, insulin receptors, and so that's a big part of it. And I try to simplify it because gut integrity is like a whole thing by itself, and then we got the gut barrier, which we have this nice little mucus there. And of course, in the gut, when you log into the Advanced Functional Medicine portal, you can learn on how to address each one of them. So there's a class on gut-brain and how to do a reconditioning of the gut-brain by Dr. Matteo Caviola, who is an amazing functional medicine physician. There's some really great classes on how to strengthen the barrier. There's a class on there's like specific classes on how to strengthen the integrity. So for example, strengthening the integrity, you want to make sure that you regulate zonulin. You want to regulate zonulin secretions because every time you get a zonulin secretion in your gut, it opens up the tight junctions. So that's what we refer to as the integrity of your gut. And there's a lot of stuff that could help you regulate the zonulin. One of the things we want to make sure is that our patients don't have a reaction to gluten, for example, because that can cause an excessive zonulin reaction with some patients. One of the major factors in functional medicine that can cause a lot of those conditions that we have mentioned. So, how do we explain this to patients? If you have an imbalanced bacteria in your gut, this is what we call dysbiosis, it could change your digestion. It can change your immunity and cause inflammation. It can impact your glucose control. It can even impact your gut-brain signaling, causing anxiety, depression, fatigue. It can worsen systemic inflammation, which eventually would lead to more damage to your nerves. This is a really important factor to look into because what we want to, and the signs and symptoms that you currently have, patient Joe, is gas, bloating, constipation, diarrhea, food sensitive. Maybe you have eczema, maybe you have fatigue, maybe you have nerve damage due to the inflammation. So I always want to learn how to explain the functional root cause to patients. So now we're on the same page. And the more you explain, the better you'll become at it. And we would get in our practice, for example, something that I wanted to share with you. We would get to a place in our practice that we got so good at explaining, or my team got so good at explaining the root cause is causing their symptoms, that patients would ask us, well, what do I do about it? Like, I need to know, what do I do about it? Like, what's the next step, right? You want your patients to be like, what's the next step? What do I need to do, right? It's almost like all you got to do is just show them the labs options if you think that would be appropriate, or start talking about what's the next step, right? We'll need to do this in the first month, this in the second month, this in the 4th month, right? Just as an example. So speak in general terms. We're not getting into the treatment protocols yet, because we first want to understand what's causing it and how do we explain that to the patient. Optional labs. You can write this down. You got obviously the comprehensive stool analysis. You got GI 360 is a really good one by Doctor's Data. It's one of the most comprehensive ones. It's also something that patients can order online. Genova Diagnostics has also a really good one. It's called the GI Map. It's also offered by other companies, but if they go to Genova Connect, they can actually order for themselves. So they don't even need a requisition form in most states. And then SIBO breath test. I wouldn't recommend necessarily the SIBO breath test as a comprehensive. It's good to do to see if they have dysbiosis, but SIBO breath test does not tell you what's the composition of bacteria in the gut. You need a stool analysis for that to see what's the inflammatory markers, what's the short chain fatty acids level, which we talked about. Do they have too little butyrate, which is important because it's anti-inflammatory, it's important for metabolism as well. Do they have too much high of secretory IgA, which is a marker of inflammation or immune overactivation? So we want to look at the whole picture. Typically a GI comprehensive stool analysis is better. Here's a study if you want to read more about, it's called the Healthy Human Microbiome from journal Genome Medicine.